Assalamu alaikum. Starting the clinical day, we have Mrs. Julia, 55 years, with complaint of vision problem. Ready, Dr. Sarah?
Yes, Dr. Hello, my name is Dr. Abdullah. I'm one of the medical doctors in the clinic today. Can I confirm you're Mrs. Julia?
Yes, I am.
You are 55 years old?
Yes, I am.
Yes. Can you tell me more about what brought you to our clinic today?
Yeah, doctor. Actually, I was wondering what happened to me yesterday. Suddenly, I lost my vision.
I'm really sorry to hear that. This is still is ongoing, or it came and disappeared?
As it comes by itself, also it's resolved by itself. I don't know what happened, doctor. Like
Okay.
magic.
Okay, and this is the first time, right?
Yeah, doctor.
I'm really sorry to hear that. So now your vision is okay?
Yeah,
So
doctor.
you can see totally okay. This is affected which eye?
The right eye.
Okay. Can you tell me what happened exactly? What did you feel when this problem happened? You had a problem?
I just was eating my dinner with my husband. Then I felt like blackout. I couldn't see by the right eye at all. Then when I sit down, I don't know what happened again. I found everything was fine.
So once you had this problem, you were sitting, right? You were sitting
Yes.
with me. Okay. Okay. Did you have any trauma
No,
previously?
no. At all, doctor.
Did you have any headache?
No.
Did you have this was painful or painless, this
No,
problem?
no, doctor. At all. I didn't feel any pain.
Okay. Um, so can you tell me, sorry to ask you, what's long-standing diseases you have, Mrs. Julia?
Yeah, doctor, I have a lot of problem in my health. I already diagnosed with diabetes, and also I have high blood pressure,
Mm.
and
And
I have also problem in my gland.
which gland do you mean?
I think it's thyroid.
It is active or hypoactive?
No, doctor, it's less active, lazy one.
Okay, and you're receiving medication for this one, for all these problems?
I am, doctor, yes.
I'm sorry to ask you, are you compliant on these medications?
I'm trying, doctor, my best.
Okay, and the readings are okay for the blood pressure, for the diabetes, for the
The
thyroid
last
problem?
time I checked, my blood pressure was 150/100.
Mm.
Yes.
What about,
And yes, the hemoglobin A1C almost around 10.
all right, what about your thyroid problem?
Last time I had checkup maybe 6 months back. I think also it was still not controlled, doctor.
It was uncontrolled. Did you have
Yes.
any, did you have any problem with your lipids or cholesterol level?
I think so, doctor, but I don't know. I'm not taking a medication for that.
Okay. So can I ask you, how about your diet and exercise? Is that okay? Are you
Uh,
following the instructions of the physician that you are following?
yeah, I'm trying, doctor, also that.
Okay. Can I ask if you had any previous clots in your any clots in your blood channels in the brain before?
No, doctor.
Okay. Any problem like chest pain or recurrent chest pain?
I had before, doctor. Yes, and I did catheter.
All right. This was how long ago?
It was 2 years back.
And this chest pain is still recurrent?
No, doctor. I can tolerate.
So no chest pain for the previous
No.
2 years. And this time of 2 years ago, did they did something called stent, or they did some?
Yeah, they did that.
Okay. Okay. Do you have a problem walking? Any problem like pain in the leg muscle when you are walking in the back of your legs?
To be honest, doctor, I'm not that much active because of, yes, I had some pain plus my weight. I am not that much active, doctor, plus my lazy thyroid. I feel not coping with the exercise or walking.
Okay. How can I so just ask you how much do you think how much your weight or something we call BMI if you have heard about it?
Yeah, it's 35, doctor.
Okay. So can I ask you if you had other vision problem or other than these attacks that comes to you, like blaring of vision, like you see
No.
blurry while you are reading or something?
Yeah, I see blurry also, doctor.
This is before, right?
Yes.
Did you visit a physician regarding this problem? Did he give you a diagnosis?
And actually, doctor, I am not adherent to my follow-up with the eye doctor.
Mm, okay. So you have followed up with him last time, and did you give did he give you any diagnosis?
I'm not sure, doctor. It was 1 year back.
Mm. So did he give you any, did he do any something called laser therapy or injection? He recommended this to,
No, he did not. But he told me I have to control my diabetes and so on.
okay. Are you having pins and needles in your hands or legs?
Yes, doctor.
Okay, I'm really sorry for that. Do you have any frothy urine or problem with the urine
Yeah.
amount? Okay, and you are following up with this problem also or no?
No, no, doctor. No.
Can I ask you if you have any problem like dizziness when standing up?
Yeah, doctor. I feel also this.
All right. Any problem with the um, feeling of low blood dizziness that will improve with the food?
You mean in bowel problem?
No, I mean any low random blood sugar that you suddenly have low random blood
No,
sugar
no.
and dizziness. Okay, okay. Can I ask you more questions? Sorry. Did you have any weaknesses? Weakness in your muscle, all over your muscle?
No, doctor. But I feel less power only.
Okay. Did you have any beside the pins and needles? Did you have any numbness in your body?
Yeah, the same, doctor. It's pins and needles.
Okay. I mean, no other changes, new changes in your in sensation.
Yeah, I feel some numbness in my hand.
Mm.
Yeah, it
Both.
happened at the night. Then whenever I shake it, it improve.
Okay. So both hands or one hand?
Both hand, doctor.
Okay. I'm really sorry for that. And any um any problem with your gait? This happened during the attack that you had with your eye.
No, no, no. The same,
Okay.
doctor.
Do you have any problem shakiness in the body of your body?
No,
Any problem with the other sensation like hearing,
no,
smell, swallowing,
no,
speech?
no,
Okay. And any asymmetry of the face happened
no,
or
doctor.
dropping of
I
the
didn't.
face? Okay. So can I ask you again about the pain? You are telling me in the hands, you're telling me it goes with the shakiness of the hand, right?
Yes, yes.
Okay. What about your sleep at night? Is there any problem?
Yeah, I'm not sleeping well, doctor, and I feel tired early morning.
Any problem shortness of breath at night?
Yes, and even my husband told me that I'm snoring.
Okay. How many pillows are you
No,
sleeping?
I sleep on two pillows, doctor. No change.
Okay. Um, any racing heart?
No,
Uh, any? You told me that no other chest pain happened, right?
no.
Okay. And any leg swelling?
Yes, doctor. I feel like maybe due to my weight, I don't know.
Did
But
you
it,
feel that when you press on your legs, there is a mark in it?
yeah, yeah, it leaves mark.
Okay. Um, did you have any bleeding from any other
No,
sorry, did you have any bleeding in the history in your in your past or
no,
during the previous 2 days from any side? Okay. Uh, okay. Did you have any fever?
no,
Any weight changes? This was
no,
recently the 35, or this is always your?
no, yeah, since before long time, doctor.
Did you have any weather preferences right now?
No, doctor, I'm okay.
Any lumps or bumps in your body?
No,
Any other joint problem like knee pain or ankle pain?
yeah, my knees also, there is some pain.
Okay. Other joint pain you have?
No,
Any back pain?
no,
Any skin changes?
no,
Any other muscle problems you have?
no,
Any bowel changes?
no.
And you told me that you don't have any diarrhea or at night specifically or something that's
So yeah, I know my usual habit is like chronic hard stool.
you're always hard stool. Nothing.
Yes,
No, sorry, no loose motions. I'm sorry.
no,
And other unit changes rather than this one that you
no,
mentioned?
no.
Okay. Can I examine you?
Yeah, sure, doctor, please.
Okay. Can I examine first the eye? Can I examine the visual
Excellent,
acuity?
yes. Visual acuity, yes, she can by the right eyes. She can see fingers, but in the left eye, she can't see counting. She cannot count for you.
So, sorry, the right
Reduce
eye.
the left eye.
And the right eye is what? Sorry.
The same, it's normal, intact.
Okay. So, the left eye only hand
Yeah.
motion. Sorry, hand motion.
She
Or
cannot
not.
she cannot see the line, the smallest line in the chart.
Okay. Um. Okay. Can I check the visual field?
Yes, intact.
Visual movement.
Yeah, no, no diplopia, no pain.
Okay. Um. Uh.
What
Okay.
else?
Can I do the fundus examination?
The examiner said no need.
Okay. Can I this will be very long. Okay. Can I first check the hand, the blood pressure, sitting and
Yeah,
standing,
145 over 95.
and standing?
The same.
What about the pulse?
90.
Is it regular?
Regular.
What about the hands? Can I check the sensation of the 3.5, the lateral
Yeah,
three and a
she
half?
told you I have pain, doctor.
Okay. I can do the tunnel test.
No, she said I have pain.
Okay. What about the sensation? Is it reduced?
Yeah, always in the lateral 3.5 finger.
And what about the hand grip?
The what? Hand grip? Yes,
Yes.
she cannot. She doesn't have good hand grip. Some weakness in especially the opponent's muscle.
Okay. How about any proximal myopathy?
There is proximal myopathy. 2 minutes.
Okay. Um. Okay. How? Okay. What's your concern, Mrs. Julia?
Yeah, what happened to me, doctor? Why my vision lost then it's back by itself?
Yes, I think this is a problem regarding your your long-standing diseases like the diabetes and hypertension and the thyroid problem. This has led to a problem with the cholesterol on the lipids or on your blood. And I think you had something called clot in the blood channels of your eye, and it resolved, but we have to run more investigations, and we will refer you to a group of doctors, the eye doctor and um, the diabetes doctor and the endocrine doctor to help you more regarding your issue.
The gland, doctor.
The gland doctor, yes. Any other concern, Mrs. Julia?
Yeah, doctor. Might happen again. This.
Yes, it could happen again. So we are going to give you, as I told you, we're going to run some lab tests and some imaging studies, and we're going to prescribe you some blood thinner medications to help you prevent this episode of hand bleeding again. And also, you have to control your diseases to prevent such attack to happen in the future.
Okay, doctor.
Can I examine more?
Yes, sure.
Can I look at the neck? Any neck swelling?
Yeah, there is neck swelling.
Okay. Can I hear the pulmonary any pulmonary hypertension, palpable P2 or palpable
No,
P2 or accentuated
no,
P2?
no.
Okay. Can I examine? Okay. Can I examine the peripheral? Okay.
No, time is up.
Mm,
Okay, well done, Dr. Sarah.
mm.
Let's go to the examiner question, then I will comment. Yes, what was your case about?
So I think this patient had sudden loss of vision in the right eye. This is most probably due to a thromboembolic event due to the uncontrolled diabetes, hypertension, and hypothyroidism. Most probably amyloidosis fugax.
Excellent.
Okay.
Yes.
Mm.
Yeah. What other differential for vision
So,
loss?
so we have to exclude other causes of sudden visual loss, like for example, embolic rather than thromboembolic. She could have, because she had history of ischemic heart disease, she could have also associated the paroxysmal atrial fibrillation that led to some embolic event. So we have to trace her heart and do Holter monitoring.
Okay,
She's
so
denying.
yeah,
She's denying.
give me a name of differential.
Okay. Uh, uh, embolic. This is what do you mean?
Yeah, what you call it?
Okay, embolic.
Okay,
It would,
let's assume this is painless or painful vision loss.
this is painless.
So give me example of other causes of painless vision
Uh,
loss. You
could
can
be.
give a lot, by the way. You have
I'm
a
trying
lot
to.
of causes. Yeah,
Mm,
yes, focus, collect your thoughts. You can give me 3 more, not only 2.
what? Because what I know is embolic, thrombotic, or hemorrhagic.
Yes,
Uh,
okay, yeah, okay. Name
okay.
it in the ophthalmology point of view.
Okay. Uh, uh, amyloidosis. This is what you mean, right? Amyloidosis
Okay, yeah, we finished the amaurosis. Then,
occipital infarction,
okay,
but I'm not sure. I'm really, I'm really
no, okay, another something
uh,
localized in the eye.
hemorrhage.
Local cause. Okay, retinal hemorrhage or retinal
Hemorrhage.
detachment. You have a lot of
Yes, yes,
causes.
exactly. Yes,
Central retinal artery occlusion, central retinal vein occlusion.
yes.
All of them are painless causes for
Yes.
vision loss, right?
Okay, okay, that's right. Yes.
And all are valid. In this case, she has uncontrolled. Okay, let's go for the investigation. How you can approach and investigate this patient.
So first of all, before going to the
Excellent.
first of all, to
Yes.
refer her urgently to the ophthalmology
Okay.
doctor to diagnose amyloidosis to amyloidosis fugax and
Okay.
also
How the ophthalmology will diagnose amaurosis fugax?
uh, I think by the fundoscopy.
Or
Or
is it radiological or clinical?
I think MRI. No, I cannot remember. Sorry.
Okay, so in the acute state, patient came to you and you suspect something. What you will do first?
CT. I'm not sure. CT. No, I believe it.
Yeah, because
Sorry.
yes, you're right. Now
CT.
it's resolved, right? So you will do MRI because no
MRI.
role of the hemorrhage here. Hemorrhage will be like the same as for TIA, right? So what you
Okay.
will, yeah, okay. So you will ophthalmology urgent, as you said, and neurology or TIA clinic to arrange for MRI,
Okay.
urgent MRI, right? Within 24 hours.
Okay,
Okay.
that's right.
Okay. So you will deal with the patient as TIA case, right?
Yes, that's right.
Okay. Then apart from this, what investigation?
Okay, first, after stabilization of the patient, we will do basic investigation like CBC, kidney function
Excellent.
test,
Mhm.
and we will do hemoglobin A1C, complete lipid profile,
Excellent.
and also we will do complete coagulation profile.
Excellent. One
And
more. Consent to
uh,
her case.
thyroid profile
Excellent.
also.
Yes, yes, exactly. Okay.
And
Okay.
then uh,
How
uh,
to manage this patient if came to you in the TIA clinic after
uh,
investigation?
yes, after investigation, we will give her once presented, we will give her antiplatelet therapy,
Yes, loading dose.
loading
Yes.
dose of antiplatelet therapy, then maintenance dose to prevent
When when you switch,
uh, after what we are doing, that we're giving loading,
then
after
maintenance.
then maintenance, yes. After 24 hours, I'm guessing only after
For the long term, what you are giving antiplatelet?
uh, they prefer the Plavix. Really, I cannot remember.
Yes, yes,
Yes, Plavix.
Plavix,
Yes,
yes.
Plavix. Yes.
Okay,
Uh,
and what else?
so we have to give her before giving the emergency medication. We will give her. Then we will give her the non-pharmacological management like patient
Excellent. Yeah,
education,
this is most
patient
important. Yes.
yeah, patient education, patient counseling, diet and exercise. Stop smoking, stop alcohol. In her case, we should also stop driving until we get proper management and proper diagnosis in her case, and also to refer to multidisciplinary team, the ophthalmologist, the endocrinologist, and endocrinologist diabetes doctor, really, and the
Okay.
specialized nurse. Then the pharmacological will be the proper control of diabetes. Hemoglobin A1C was 10, I think, according to, because I did not get time to check the drug. So most probably we will shift her on insulin, and also proper control of the hypertension, and
Control comorbidity, yes.
control the thyroid. Yes, thyroid. Also, we
Comorbidity.
will give
The
her,
all comorbidity, yes.
because also her CVS 10-year score is high. We have to give her uh, a statin or
Lipid lowering therapy.
lipid
Yes.
lowering.
Yes.
And then we will control her all complications because she has the weight gain problem, like the carpal tunnel syndrome and the sarcoslemia. We have to direct her to the uh, dietitian for proper weight reduction and
Excellent.
exercise. And regarding her bleeding, also, we have to check if she has diabetic. Most probably, she has diabetic retinopathy. She has to get also management for that with the ophthalmology, and also she has pins and needles and pins and needles.
What's
So
called pins and needles?
peripheral neuropathy. She has peripheral
Yeah.
neuropathy. So also this will be controlled with the control of diabetes, and maybe she will need the duloxetine or pregabalin or gabapentin.
Yeah.
Regarding the fourth urine, we will give her. We have to.
Diabetic analgesia, yes.
Uh, yeah. Regarding the fourth urine, we are going to start her most probably on ACE or ARBs according to her kidney function test, and also maybe we will need to start her on the SGLBT2.
However, you didn't ask if she's on ACE inhibitor. She might be on ACE inhibitor, right?
I did not have time to ask for.
Okay.
her.
Okay. So I just give
Mm.
a complicated case to know
I'm not
how
sure
to.
in such case we have
Yeah.
time to check all the complication of diabetes. I'm not sure really
Yeah, they will judge on your approach, on your priority for the screening, for the history, for patient welfare.
Mm.
As in this patient, you must ask the driving.
Yes,
Is that? Yes.
yes.
Yeah, you were confused between the whole symptom and the whole system to ask about system view or to ask about the
That's right.
complication of diabetes. So what do you think is better here?
Diabetes, I think we have to focus on diabetes
Yes, of
100%.
course. Diabetes, the medication, the compliance, because
Yes.
yeah, she's neglecting herself, and also you can give her some advice regarding the nephropathy, neuropathy, and retinopathy, the driving. All these things will be much important. Although you touch most of the point, like neuropathy, autonomic neuropathy, you ask about it. You ask about the also the retinopathy, nephropathy, ischemic heart disease. You cover it. I think you did great. Apart from taking long time,
Mm.
you should finish at minute 9 and
Mm.
start examination because you have a lot of finding in this patient.
Yes.
Plus the social, you didn't ask any question about smoking, alcohol,
Yes.
driving, and job.
Yes.
Yeah, family history as well. So it's a clear case and straightforward one, but it's complex one. I brought it as an example of the complicated case. Sometimes they are bringing such cases just to roam between the system, and sometimes also they put heart failure, and you can also they can go through the heart failure management. So you don't know what you will face in the exam. Sometimes yes, one diagnosis and a clear case. Sometimes autoimmune association min or auto like association of autoimmune like mixed connective tissue disease. So you can arrange yourself how to start and how to prioritize the system and the complication to ask about. But you did great apart from the less time for examination. Okay, I'm advising you, but in the same time, I don't know what I will do. Maybe I will be also maybe more than you, confused than you. I don't
Uh,
know, but yeah, we are trying to put priority what to ask and what to just skip. But I think all system here will be affected because of diabetes. But at least you reach to the diagnosis, which is amyloid fogax and transient vision loss. This is the top of the differential. You can also put, as I said, but the other cause will be not transient, will be like permanent, like central retinal artery occlusion, central retinal vein occlusion, retinal detachment, retinal hemorrhage. All are causes of painless vision loss, and it might happen with this patient. The only thing going with amyloid bucax here that the patient vision regain or recur to normal. But if loss, you will be in trouble. You have to rule out every reason. And you might also do that by fundoscopy. The fundoscopy might help you for the diagnosis. But in the transient loss, I think the case is clear and you can get the mark. Just give some time to the examination.
yes.
Okay.
Okay.
And the management plan, of course, we know all of us the management for the comorbidity and TIA as a cause of for any reason, embolic, thromboembolic, the referral, the multidisciplinary team approach. I think we can deal with the management and the investigation. We can answer well, but the most important thing is to put good differential and to do good examination, target examination, and the history will be target with some advices related to the lifestyle and the welfare, like vision, driving, and the support at home. Okay, I think I'm done with this case. If you want to ask any question.
يعني دلوقتي يا دكتور احنا لو اتكلمنا عن الديفرنشال دايجنوستس مفيش حاجه ترانسيانت غيرها صح؟
Yes,
احنا
almost.
ممكن ندخل ترانسيانت الحاجات اللي هي ترانسيانت ممكن تكون هايبوغلايسيميا ممكن تكون مالتيبل سكلوزس بس اجينست ذات كذا كذا كده يعني لكن هي
Yes,
مينلي هي الترانسيانت الراجل الكبير اللي عنده دايبيتيك هايبرتنشن في الغالب هي لكن انا لما اجي احط ديفرنشال ترانسيانت ممكن اي حاجه ترانسيانت بقى اللي هي تي اي اي زي ما احنا بنقول تي اي اي وهايبوغلايسيميا مالتيبل سكلوزس
No, you put for transient only or for the vision loss in these patients?
لا for transient loss vision loss عايزة أعمل differential transient vision loss هي مين اللي هي الأمورسيس فيجاس مفيش يعني
Yes,
لكن
only it's so you will give differential in this patient for the vision loss possible causes, but the only one will be painless transient amaurosis foveatis.
I was going to ask about the hypoglycemia during the attack, but she was eating actually, so I don't know.
Yeah.
Eating
Yeah,
or
I told you the blood sugar always high. I didn't have any, or I didn't had any of hypoglycemic attack.
okay.
You ask this question if I have hypoglycemic attack.
Yes, that's right. Later on, I asked.
Plus it will be coming like hypoglycemic seizure or shivering, not only vision problem. And this one also will be under the term of syncope, not vision loss. Specifically, vision loss, yeah, it will be like this, and transient with the sometimes mirose Foucault might be bilateral or unilateral, by the way. Okay.
Okay.
So I will put Dr. Shema, I will put the same what I mentioned. I will not say multiple sclerosis because multiple sclerosis is too much different. The patient will have painful
أيوة
vision.
صح بس هي كلمة
Yeah.
transient أنا عارفة إن هي بنت بس transient يعني بشوف
Yeah,
كده
it's
في حاجة تانية
transient
ممكن
but painful. Yes.
طيب في حاجة تانية يا دكتور إحنا لما بنيجي نعالجه بنقسمها إزاي؟ لأن هي ما شاء الله قالت كل حاجة
Yes, exactly.
دكتورة طبعا معايا. أنا بس عايزة أقسمها يعني أمورسيس فيجاس أنا عندي تريتمنت إزاي هقسمها؟ نون فارماكولوجيكال
Yeah,
وفارماكولوجيكال
you can start by the multidisciplinary team approach. For any answer with multi-system affection, start by multidisciplinary team approach.
يعني
Starting
ده
by
النون فارماكولوجيكال
no before
non-pharmacological
non-pharmacological no before non-pharmacological. This is the first
multidisciplinary
answer you mentioned. Multidisciplinary team, because the referral here is very important than education, right? To refer here for ophthalmology and neurology clinic,
ماشي
because she might have another TIA and she will have or a stroke. She might have a stroke next time and you will be in trouble. You just give her education and she will not ever be controlled from first or second meeting.
بعد المالتي ديسيبلينري تيم ابروتش
Yes. Yeah, referral, if need urgent referral, you have to mention the urgent referral. TIA and stroke, you should refer to the neurology clinic. A stroke, of course, as acute, you have to do ABCD approach. But TIA, urgent referral, which is within 24 hours, they will do MRI, carotid scan, Doppler, echo, Holter, lipid profile, all blood investigation. This is for the urgent referral. Then you will go to the non-pharmacological, your education, counseling, the importance, the driving, the control, the lifestyle, the dietitian, all this can be as non-pharmacological. The last thing, the pharmacological will be according to the reason. If there is
لو هي
AF, for
ترانسيانت
example.
اسكيميك اتاك لو هي ترانسيانت اسكيميك اتاك مفيش اي اف بديها اسبرين صح؟
Yes,
اسبرين لودنج دوز هي
yes,
300
yes. For 2 weeks, then switch to Blavix.
لا بس
Okay.
Okay, what if there is AF, Dr. Shaimaa? What do you think?
المفروض اعمل كنترول للاي اف الاول
What?
اعمل كنترول للاي اف صح؟
What other answers? Dr. Sarah,
anticoagulant
how you will give anticoagulant?
ممكن نواك بقى ممكن
What?
اديها نواك اديها نيو اورال anticoagulant
Okay, so before answering this, you have to call the cardiology, right? And to check the duration of AF. Okay, we assume that the duration of AF more than 24 hours or 48 hours. What's your decision? You will start anticoagulant or you will do something else?
We will check the chest flask first.
Excellent. Yes, the score. So the score will guide me either to start or no. Chad's Basque score. According to the score, you'll be decided either to start or no. So everything, every point you will be answer according to the question. But in such cases, there will not be one question or one topic to be asked about. He might go through the AF. He might go through thyroid, diabetes, hypertension. So we have to control all these comorbidity. And I think by multidisciplinary team approach, this is the best answer for this condition.
I think the best approach for this patient is to ask about driving. On the first instance, you ask about the visual problem. I think.
Yes, I told you before, whenever you have vision complaint, write down driving. Write it, because whenever you are planning to ask, you will forget. If you didn't write and circle or make it by bold letter, you will forget it. Any vision. The same as if you have a female in the childbearing period, you write for pregnancy and female history. Some system and some question you might forget, try to write it in the corner or in a circle or whatever. Because other system review, you will do it definitely. The constitutional, yes, sometimes you are not forgetting them. But driving with the vision, you might forget while you are taking history, and it will be against you, and it will be minus in the mark if you didn't ask about vision. Good thing if you remember with the examiner, at least you will be minus the half mark, he will minus you. But you should explain to the patient, because this is for the welfare.
He will minus from the welfare, right? Welfare.
Yes. Yeah. Okay. I think we talk a lot in this topic. It's a clear case like TIA, and TIA as any TIA. So the management is the same, but in this patient, we talk about vision loss specifically. Okay, any comment? Okay. No comment. We can move to the next scenario, Doctor. You wrote it. Okay. 35 years old patient, difficult standing from sitting, and visual problem. Okay, Mr. Donald.
Iya. Stai sorrando il
Okay, ready?
Okay.
Let's start. Hello, I am
Hello.
Dr. Mukhtar, the doctor in the clinic today. You must be Mr. Donald.
Yes, I am the one, doctor.
You are 35 years.
Yes, doctor.
We are here to discuss about your health issue. Is that okay for you?
Yes, please, doctor. Yes.
Okay, can you tell me more about your problems?
So, doctor, I have noticed that I really have difficulty standing up while I'm sitting, and also I have this blurry vision that really comes and goes. So I came to you to help me, doctor.
Yeah, I'm so sorry about your suffering, Mr. Donald. We are here to help you as much as we can. Okay, can you tell me when it started exactly?
So this problem of standing problem, it started
Yeah,
about 7, 8 months ago.
okay. And do you think it's progressive
Yes, doctor, it's getting worse.
and started all of a sudden?
I cannot say all of a sudden, doctor. I think it started gradually.
Okay, any previous attack? Same, I
No,
mean, this the first time ever.
yeah, it is the first time ever, doctor.
Okay,
Really, I was an active man, but now with this problem, really, I feel myself less active.
okay. And do you have any difficulty while combing your hair?
No, doctor.
It's okay, okay. What about opening jars? You can open jars easily, or you can handle with your hand.
Mm, yeah, doctor, I have no problem with that.
So only standing from sitting.
Yes, doctor.
Okay. Uh, what about the vision? When it started exactly?
I think also 5 months ago, I have these attacks of really blurry vision.
Okay, this in both eyes.
um, yes, doctor, but more on the right eye. That this actually comes and goes, but more on the right eye.
Did it with the hot weather or hot shower?
No, doctor, not related.
Okay. What about the color vision?
No, I don't think it's affected, doctor. Yes.
Any night vision affection?
No.
Any pain in your eye?
Yes, doctor. During this blurry vision, I really have painful eye.
Both eyes or one eye?
Yes, when as I told, it comes and goes, but when it comes, it's really painful. Especially the attacks come to my right eye more than my left, doctor. But it comes to both, doctor. Yes.
What do you think can improve this?
Nothing, doctor. I have tried. I have tried pain medication. It will improve a little bit, then it will go.
Okay, how about the pain scale? If I give you pain a scale from 0, no pain, and 10 is the maximum, how can you scale this pain?
I think 6 to 7.
Okay, yeah. Are you okay now, or you have any pain?
No, I had the last attack was about 1 week ago. Now I am okay, doctor. Yes.
Okay. Did you seek medical advice?
Yeah, yes, doctor. I went to the eye doctor. He told me only to give some eye drops, I think, but it did not improve, I think, because I'm afraid it will come back again, doctor.
Okay. Are you diagnosed with any long-lasting disease?
No, doctor.
You have any high blood pressure,
No,
high blood sugar,
no,
any surgery before,
no,
any allergy to any medication?
no.
Okay. Do you drive, Mr. Ronald?
Yes, doctor.
Okay, temporary, I can ask you to stop driving till we reach to the diagnosis. Is that okay for you?
Yes, it's okay, doctor.
Any family problem with the same condition?
I think, yeah, I think my uncle, he had some bone issue, some problem with his bones, some joint or something in the back. He had some problem,
Mhm.
but I'm not sure
And
what it is.
you don't know the diagnosis?
No, I don't. I don't
Any
remember.
other family member?
I think they, my uncle, and I think my nephew also had this problem, doctor.
What about your parents?
No, nobody has a
They
problem.
are fine. Okay. Any weakness in your body?
No, doctor.
Any vision problem? Sorry, any hearing problem?
No.
Any balance problem and steadiness?
Not balance, but I think I have also walking difficulty, doctor. Really, I cannot walk well.
Okay. And you notice the distance is short while walking before feeling tired?
Actually, once you mention it, I think it's better with walking, doctor. When I have this problem, I think it's better with walking. Once I have some walking, it will become better after some while.
Okay. And did you notice any change of the eye color?
No, doctor. During the attack, you mean?
Yes.
Yes. During the attack, it's become really red, doctor. Really red and really painful. And I had a lot of tears, doctor.
Okay. You told me no headache with that.
No,
Okay. And you have any difficult swallowing?
no.
Okay. Any particular timing for having this attack? At the evening, at the morning, at the night?
For the eye, no. It does not have a specific time, doctor.
Or for the walking?
For the walking, I think the problem in the evening time more. Once I'm in the evening time, but once I'm active, as I told you, in the morning, it will become better, doctor.
Okay. Any pins and needles in your legs or your hand?
No,
Any intolerance to any weather?
no,
Okay. And any chest pain?
no.
Any short of breath?
Actually, yes, doctor. I think I have some shortness of breath.
And is it in particular time
No, all the time.
while doing exercise?
Yeah. It's with the exercise, with the sitting. It was never there before, but now I noticed also in the previous few months that this problem happened also.
Okay. Do you smoke, Mr. Donald?
No, doctor.
Drink alcohol?
No,
What's your job?
I'm a teacher, doctor.
And how is that affecting your job?
Yeah, I have a problem, doctor. Really, I cannot, as I told you, because of this difficulty standing. Really, I feel it will come better after in the middle of the day, after some walking or some going around the school. It will become better.
Any joint problem, Mr. Donald? I'm so sorry for your problem. I will try to help you on this. Can I ask you for the question? Do you have any joint problem?
Yes, doctor. I think I have this back pain.
And when exactly?
It started 1 year ago, doctor.
1 year. Do you notice the back pain worse when you take rest or when you do exercise?
Yeah, it's as I told you. I think it's the same. It become better after exercise, doctor.
Okay. Is it both in the upper or lower part of your back?
My lower back, doctor.
Okay. You feel any stiffness?
Yes, doctor. Stiff. I feel stiffness, yes, doctor, especially in the morning.
Okay. Is it more than 30 minutes?
Yes, doctor. But it will be better with exercise, as I told you.
Yeah. Okay. Apart from this, you have any other joint pain, like in the hand?
No, doctor.
Okay. Any skin rash?
No,
Okay. Any change of your bowel habits?
no,
Any fourth urine?
no,
Okay. Any muscle pain?
no.
Okay. You have any, sorry for this question, you have any problem with your intimate relationship?
No, doctor.
You have a partner?
Yes, doctor, I'm married.
Okay. You have any other casual relationship? Sorry for this question.
No, doctor.
Any sharing needles?
No,
Any recreational drugs?
no.
Okay. May I examine you now?
Yes, please, doctor.
Okay. Starting by general look, any characteristic feature of the patient like position, flexion, position?
Yes, he has he has some kyphosis.
Kyphos. Okay, now I'll ask him to expose the whole back. Any other feature like scoliosis or lumbar loss of lumbar lordosis?
Yes, loss of number does possible.
Okay, and he has flexion position, right?
Yes.
Okay, now I will ask him to stand at the wall. Can you please stand to the wall and we'll check for the exhibit wall test. How many is less than 5 centimeter, I guess. Or sorry, more than 5 centimeter. He can't touch, right? He cannot touch.
Yes, that's possible.
Okay. Now I will ask for modified, sorry, some exercise. I will do some exercise and do as me. Flexion front to the back of the neck,
Limited.
limited. Right and left.
Limited.
Okay, the back, bending right side, the back and to the left.
Limited.
Okay, now I will do modified Schubert test from the dimple 10 centimeter above, then 5 centimeter below. I will put marks. Please, can you bend forward?
Yes.
It's less than 21, right?
Yes. Possible.
Okay. Okay, I will ask him to sit down.
Mm.
Then I will examine the hand first. Any
Mhm.
joint problem?
No.
No joint problem. I will ask the back examination at the area of the tenderness
Uh, no.
before he sit down. Okay. Okay, I will now examine the pulse. Any decrease of the pulse?
No.
Normal pulse. Okay, any change of the pulse volume? Is it high volume pulse?
No. Sorry. Yes. There is some yeah.
Okay.
There is more to have.
Yeah, high volume pulse. Okay, now I will examine the eye. Can you look up?
Yes.
Yeah.
Visual movement is normal.
Okay. Any redness?
Now, no.
Nothing. Okay. Can I open? Can you open your mouth? I will check for any soreness.
Negative.
Okay. The hairline. Any skin rash?
No.
Okay. Then I'll examine for the heart apex in place.
Yes.
Okay. Aorta. I will ask for any murmur, especially aortic rigor.
Yes. Positive.
Positive. Okay, you sit forward? I will examine the chest at the apical. Any decrease air entry or expansion?
From the back or the front?
Back. Apical.
Apical from the front. Yeah, there is some fibrosis. There is some
Yeah,
pulmonary.
crackles, inspiratory crackles. Okay,
Yes.
and can you cough, please, for me?
Yes.
Does it change?
No.
No change. Okay, I will offer for abdomen examination for
Minutes.
palatable kidneys.
Negative.
Negative. Any change in the knees? Any pain or crepitation? Okay, the joint in the leg, the foot, any change?
Achilles. No. Negative.
Tendon Achilles for any redness or inflammation site or
No.
pain?
Negative.
Nothing. Okay, what's your concern, Mr. Donald?
What do you think is the problem with me, doctor? Why I have this problem standing up? Why I have the problem also difficulty in walking?
Yeah, I appreciate your concern and your worry, Mr. Donald. Actually, after I examine you and after I ask you about some questions, mostly this feature suggestive of disease called ankylosing spondylitis. Don't bother about the name. It's a condition which can be running in family and it's considered one of the autoimmune. Again, don't bother about the name. It's some defense system problem attacking the joint and also some other organs in your body, showing the symptoms you have.
Okay.
You have any other concern?
Yes. Is it curable, doctor?
I appreciate your concern, Mr. Donald. Although it's not curable one, but it can be controlled. We have to take some medication, some specific exercise. It might help in your condition. However, it's not curable one. You have any other concern?
No, thank you, doctor.
Okay, temporary because of limited movement of your neck and eye vision problem. I can advise you again, please don't stop, don't drive or stop driving. until we have a confirmed diagnosis for your condition. That okay?
Yes, okay, doctor. Thank you.
Okay.
So, what's your findings by
Yeah.
examination?
Mr. Donald, 35 years, came with the complaint of standing, difficult standing, and visual problem, along with the finding in the examination suggestive of symptoms and signs of ankylosing spondylitis in the form of modified Schubert test was positive, limited movement in the neck all directions, and also there is kyphosis. Apart from this, I could find the association of ankylosing, especially in the form of aortic regurg. There is murmur of the aortic regurg along with the high collapsed pulse. I could also appreciate apical fibrosis finding in the form of respiratory crackles, which is not cleared by cough. Anterior uveitis is not is associated on and off in the history, but however, it's in the examination was normal. Apart from this, I couldn't find other association.
Okay, how can you invest, or what's the differential diagnosis first? Differential diagnosis.
Yes, I put in this patient while the complaint was difficult standing and visual affection. Top of the differential myotonia dystrophica, since also there is family history. Also, I put Friedreich ataxia as a weakness and eye affection, and multiple sclerosis, although it's not common in male. Myasthenia gravis as well can happen with the weakness along with vision problem.
Did you confirm if proximal myopathy is negative?
Yes, I missed the examination from proximal myopathy.
Okay, did you ask for the gate?
Yes, no time for the gate. Yes, I couldn't ask him
So
for
by
the.
mistakes. Okay, so how can you investigate this patient?
Yeah, apart from baseline basic investigation, CBC, I could find anemia of chronic disease. Also, inflammatory markers, SR, CRP, for it might be raised. Kidney function, also, I could do to rule out any kidney affection in the form of amyloidosis, urine dipstick as well. The other investigation will be for baseline and for routine. Specific investigation for this condition, I can do human leukotriene factor, human leukotriene A, B 27, HLA 27.
Yes.
Okay. Yeah, since there is family history. Also, I can do some investigation for the complication like ECG for heart block, echo to confirm the association of aortic regurg, chest X-ray for apical fibrosis, and it might need to be done as a high resolution CT chest. The diagnostic also here as association for sacroiliitis, I could think starting by chest X-ray of the hip, sacroiliac joint bilaterally. Sometimes it will not be showing any abnormality, so we can proceed for MRI. Sorry, yes, MRI.
Yes, that's right.
Hip.
Okay, what you will find in the MRI? What's your finding?
Yes, inflammation and also what's called in the back. I can find bamboo signs, ossified. Yes, this is what can I remember now.
Okay, what is the earliest sign in MRI?
Earliest sign,
Hmm.
inflammation.
Yeah, bilateral symmetrical sacroiliitis.
Yes.
Bilateral symmetrical, excellent. Okay. How can you treat this patient?
Yes, starting by multidisciplinary team approach, including rheumatologist and orthopedic and specialized nurse, physiotherapist, rehabilitation and GP and respiratory therapist, cardiologist and echo. Education counseling about the disease and the condition and complication. Also, hydrotherapy can affect in such conditions like swimming and also graded exercise. For the pharmacological therapy, we can start with the non-steroidal, two drugs of non-steroidal anti-inflammatory. And if not improving, we can consider anti-tumor necrosis factor. Adalimumab also can help as biological therapy. Etanercept, and yes, anti-tumor necrosis factor. Infliximab.
Okay. Thank you, doctor. Thank you.
Okay, thank you.
Okay, you did great, actually. Actually, this patient is difficult, I think. Because also I did this one with a mentor, so yeah, it was a little bit difficult situation. So difficult standing from sitting position will direct you first.
Yes, exactly.
Myopathy. But once you ask about combing hair, he will tell you no. So this is not proximal myopathy. So difficult standing from sitting position, you have to ask about affection of the lower limbs, like is it affecting the walking or not? So he will tell you yes, the walking is affected. From that point, you can think any difficult walking. You have to ask about any pain. Better to ask about any pain. This is what I do, yani. So difficulty walking, he will tell you yes, I have back pain. From this point on, you will have the guidance toward the diagnosis. Also, looking at the patient will help. And now, because we are online, you will not have the patient in front of you.
Exactly, yes.
Yes. If you have the patient, yeah, that's right. If you have the patient in front of you, it will be easier.
Exactly.
So yes, we have two main parts in this scenario. First of all, the recurrent uveitis. So recurrent uveitis, you have to ask about all the seronegative arthritis. You have to ask about Behçet disease, and some people will say also sarcoidosis, but I think the most important is to exclude all the seronegative and the Behçet, and you reach that by analysis of the blurring of vision. The blurring of vision, you will ask about is it far, is it near? Most probably far. It would not be important. The near one is the more important. About the diplopia, about the bumping side objects, this all will be negative. Then you will go if there is pain or not. He will tell you it's painful, so you have to ask directly if there is redness or tearing. So he will tell you yes, there is redness and tearing. So this will be uveitis. So as I said, yeah, you have to exclude the seronegative, all the seronegative and the Behçet. And also the back pain here, it will be inflammatory. Also ankylosing spondylitis is diagnosis of exclusion. So I have to exclude psoriasis and by asking about skin rash and to examine, as you the doctor, in the back of the on the neckline and the back of the ear. You have to examine for both. And also you have to ask about to exclude the enteropathic, about any problem with the bowel motion and the reactive inurash in the private area or the urine changes. Urine changes also will be important for the amyloidosis because yes, as a doctor, amyloidosis is very important in such cases because it can come early in the disease. So you have to ask about both burning urine and also about the filthy urines. Then after that, you have to check about all the complications of the ankylosing spondylitis. He said he has shortness of breath, and it's progressive. So this most probably apical fibrosis. Also, you have to check for the aortic regurgitation by examination, and they have problem with the EV block. So as you did to check for the pulse and any abnormal racing heart or abnormal feeling of the heartbeat is low or something. And I said amyloidosis is very important to check for the palatable kidney and the frothy urine, as you did, doctor. And also some people will check for lower limb edema also. The last thing is the acute tendinitis, and that's it. The examination as you did, exactly. Nothing about the examination. Yes. The most important thing about about the examination of this patient, and this is my mistake, but also this happened with me, to check for the gait and ask the patient to stand up from sitting position to check for the proximal myopathy, because this is the most important proximal myopathy is the most important differential diagnosis here, and also you have to check for the gait because of the problem with the walking.
Dr. Sarah, what the characteristic gait here? I think it's not characteristic one, just flexion position.
Yes, but just to differentiate from the other, from the waddling gait, right? From the proximal myopathy gait. I don't know. Some people will say gait is very important with the back pain, so just to check the gait.
I guess it will be only while he's
يا
turning.
سارة
While he's turning
دكتورة
only.
سارة
أيوة.
Yes.
الاسبوت diagnosis شنو؟ انكايلوزن؟
Yes.
Yes.
انكايلوزن صح؟ أنا حسيت إنه انكايلوزن. طيب دكتور، شايفة دكتور باسم لما قال ما خدتها في التوب صح؟ ما خدتها في التوب صح؟
لا, it's difficult to put it on the top because he's really putting a very what you call it, he's directing you toward proximal myopathy, but when you do analysis, it will not be proximal myopathy. This is why this is the trick in this case, that it's not proximal myopathy. It is back pain and sacroiliitis. The problem here is that he has bilateral sacroiliitis and also he has back pain.
طيب حاجات السينس اللي قالها دي الام اس تاني قلت شنو يا دكتور سامي باسم اسمك قبل ما يجيني في 3 differentiate كده بالسينس.
You give 3 differential for my name. Okay. Myotonia dystrophica. Myotonia dystrophica.
myotonia تمام.
Yeah, because of
وتاني
the proximal myopathy and vision, like cataract or retinopathy.
Actually, I think better here to say the other seronegative. Yes, seronegative and basic. I think
as back pain, because I always put differential for the complaint, not for the diagnosis.
Yes, but here because it's really tricky. Here he's guiding you for proximal myopathy, but once you analyze the case, it will be seronegative. So in the differential diagnosis, you have to put the seronegative and the basic.
Because it is not a true proximal myopathy. It's just a difficulty because of the pain in the back.
Yeah. I agree. Yes.
Dr. Basim also for HALA 27, it's called a human leukocyte antigen.
Yes. If
HALA is not accepted in the exam. HALA.
HLA.
Yes.
Don't say
Yes.
HALA. You say HLA better. But if you say one leukocyte factor, much better.
Because it's universal. It's universal.
Yes, it's
abbreviation. Yes.
Say HLA. Don't say HALA. Okay.
Okay.
And when I try to make it abbreviation, I mention mistakenly the number. So we are always saying yes, HALA 27 as quick abbreviation. But whenever you try to make it full, you will be mistaken. So try
For me,
to
I have a problem with ESR. Always I say
erythrocyte sedimentation rate. Yes.
It's accepted يا جماعة. Any investigation accept abbreviation. Disease or not accept abbreviation.
Thank you, Dr. Aisha. You reassure us really.
لا شفتك لا يا جماعه مش اكسبت. حتى دكتور صلاح مره قال ما تقولوش حتى سي بي سي، قولوا كومبليت بلاد كاونت.
دكتور شيماء دكتور عائشة has experience I think, and she said that based on the experience, right, Dr. Aisha?
Yes, I heard this from many examiners, but Dr. Salah has a specific way in his way, but it is accepted. Investigation accepted, but disease not accepted.
CBC is universal. Nothing will mistake.
But HALA not accepted at all. One candidate failed the exam because he said HALA. Okay, you don't say HALA. It's HLA. Yeah.
Okay.
But if you can set it, if it is easy to you, you can set all investigation by no abbreviation. But it's very hard if you try specifically about
Yes, yes.
rheumatological disease,
This
how
is
you will
without
explain all the
stress.
rheumatological disease abbreviation? You will
Yeah.
say it?
Imagine,
What about
imagine.
the MARD?
Impossible.
No, no, DMARD is known. You have to mention it. Disease modified agent. Disease modified agent for rheumatoid, for example, rheumatoid arthritis, or disease modifying agent for multiple sclerosis. It's easy to mention it. But yes, as Dr. Aisha said, the investigation is much difficult. For example, ASR, CRP, not procalcis, okay, BMB, because you used to say it in this way, but to
I
say
think autoimmune profile is difficult to.
no, no, anti-Smith, anti-double strand DNA complement.
Anti-Smith, it's acceptable. Anti-Smith,
I guess it's
anti.
anti-Smith.
هو انت عارفه حاجه غير كده اصلا واحنا عارفين ايه انت سميث ده؟
ما عارفين
Yes.
والله
No, no,
والله
it's
مش عارفين.
it's
ما حدش عارف
anti-Smith.
ولا حتى الاكزامينر.
No, no, it's
انتوا
anti-Smith.
liver function names.
بس
You
انت
will
سميث ما عارفين ايه
يعني
الاساس.
said the name of liver function if you like said, okay, we know alkaline phosphatase, but if you try to said all the abbreviation of investigation, it will take long time and no benefit يعني.
Alanine transaminase, aspartate, right? Aspartate transaminase also.
I think it's known to be ALT and AST. يعني
Yes,
nobody
yeah,
will
this
The
it's
investigation all accepted abbreviation. Don't
Nobody will
make a lot another.
yes, yes. Don't confuse
Yeah.
yourself. Also, you will be more stressed when you mention without abbreviation. I think they will not cut the mark.
You will
Only
say
the disease.
CT. It's
ما
accepted
ممكن
to say
تقول
CT,
انتي هلا
MRI. You
اسوشيشن
will
انتيجين،
not to say
ممكن تقول
HALA, HLA.
انتي هلا، ما انا ما حقول هلا، حقول انتي هلا ليكوسايد انتيجين يا
In
حسن.
English أصلا the H not read it like that. So just said HLA. Said HLA because experience said that HALA is not accepted. So we will said HLA. It's
Yeah,
not
but not memorizing the cases by itself. يعني we will not be able to memorize also the abbreviations of them.
I make this case with an examiner and he said it is يعني forget this HALA and don't practice it with with others friends because you will routinely said this with the examiner. Said HLA always.
Okay.
Dr. Basim, I have a question in the previous case, amaurosis fugax. Do we need to refer the patient to the ophthalmologist or just
Yes.
the neurologist?
Yes, for two reasons. To do fundoscopy because also she has other finding and pathology. Retinal for the retinopathy, diabetic or hypertensive. Plus for the pathology itself to rule out any optic disc atrophy or
But there is no finding after the attack is
no,
resolved.
yeah, no finding in the vision, but there is still reduced vision acuity, visual acuity because of the other change like retinopathy, either diabetic or hypertensive.
Yes.
So still, yeah,
Okay.
still she is alarming.
Okay, regarding this case, ankylosing spondylitis with uveitis,
Yes,
also we need to refer the patient for ophthalmologist.
but immediately no, because he doesn't have any
But you have to
anterior
mention,
uveitis.
you have to
And
mention that.
what
I
about
have to mention in the
investigation?
multidisciplinarity, right? But
Yes,
it's
you
not
have to
urgent
mention-
referral.
No, because
Yeah.
he has no
Uh-huh.
active
Yes, no
بصي
active
دكتورة
problem
سارة،
now.
What kind of investigation which he need to be done for him?
Everything you know about ankylosing specific,
For I mean for the eye problem.
just the HLA to confirm the diagnosis because nothing specific in the eye. It's association, right? So diagnose the cause, not diagnose the condition. It's anterior uveitis
Okay.
treatment of
and
the cause
انتي
only.
uveitis clinical صح؟ clinical diagnosis.
anterior uveitis. Yes, it will be. I think by
Slit
by
lamp?
I think even by torch. Anterior uveitis.
Yeah.
After, there will be a blurring of the, even if you put the fundoscopy, there will be blurring of the, there will be the light reflection will be lost. There will be blurring of the, when you put your to examine the ophthalmoscope, there will be blurring. You cannot see background. And also
Mhm.
the light reflex will be lost, but it's not specific, or it will be not lost,
The,
but it will be sluggish.
the pupil? Yes.
It will be sluggish, and that's it. It's more diagnosed by the ophthalmologist, not by us. I think you have to do the examination of the eye, but the main.
Yes, street lamp examination.
But for us, we
because
don't do slit lamp, so I think better to say to refer to the ophthalmologist because we are not doing slit. We don't have the.
No, I mean ophthalmology examined by street lamp يعني no more investigation as he asked يعني أو as she asked only by street lamp by ophthalmology. Yes.
Okay,
Okay,
yes.
thank you. Thank you.
Thank you,
هو انا
Dr.
بس عايز
Sarah.
ايه معلش هو الاكس راي احنا بنلاقي فيه هو اللي بنلاقي فيه البامبوساين والسكويرنج اوف فيرتبرا صح؟
This is
Bam
late sign, yes, late sign.
bamboo
في
sign,
الاكس
yes.
راي الاكس راي بلاقي بامبوساين وبلاقي سكويرنج اوف فيرتبرا. في الام ار اي قلتي بنلاقي بايلاترال سيمتريكال ساكرويليتس صح كده؟
Yes.
Yeah, this is the difference.
وفي الليت ساين بلاقي كالسيفيكيشن
Sorry?
ساكرويليت كالسيفيكيشن. في الليت ساين في الام ار اي بلاقي كالسيفيكيشن.
Yeah, this is the late sign in the X-ray, but the most important thing here in the MRI, because he has only for 1 year, so the most important thing is to ask for the bilateral
طيب
symmetrical sacroiliitis to differentiate also from the other causes from the seronegative.
جميل. الفارماكولوجيكال تريتمنت بتاعي بين كده وبدي انتي تيومر نيكوز فاكتور.
In the beginning, you have to start with non-steroidal. If no improvement, I think after
Two
after
options.
6 months,
تقريبا start by exercise
yeah, hydrotherapy.
swimming physical
Hydrotherapy.
exercise أيوة physiotherapy yes it's
Here you
بتكلم
have
عن
extreme
deformity, but here you have deformity. So I think I have read that with the deformity, you have to offer biologic directly, but I'm not sure. Because the deformity already, I think in the early you can wait for the biologic, but I'm not sure with the deformity you can wait or not. I'm not really sure.
I think it start stepwise
Yeah,
even
stepwise, yes. Non-steroidal.
maybe improve with
ماشي
non-steroidal
ما هو
maybe
نون
to
ستيرويدال. بعد كده ايه؟
to
انا
high.
مكتوب عندي لو هي سمول
Two
جوينت
agent
افكت سمول جوينت افكت.
non-steroidal. Two agent of non-steroidal. If no effect, you can choose for monoclonal biologic or anti-TNF.
What about here? Because the deformity, we can wait for the non-steroidal, or we have to go directly for the biologics.
I think this first time to hear about this concern. If there is deformity, to wait or to because the ankylosing is known as stepwise, as Dr. mentioned, whatever the steps, but you can start like ABC stepwise, and if no control, you can upgrade.
Okay. So because somebody is asking, I think Dr. Hadil is asking about the gait. I think the gait of this patient will be important only to get the deformity more, and to differentiate from other causes of difficulty in walking. That's it, I think.
Yeah, to my knowledge, Dr. Sarah, that the characteristic here in the gate, when he turn like one piece because his back is fused with the with the I mean the hips, so he turn like one piece. This is what I know.
Yes, this is what I know.
Yeah, like the Parkinson patient.
دكتور باسم انت وقفت الستوب درايفنج عشان الاي عشان رينج وفيجن صح؟
Both even the
لا
neck
بس
limiting
هو الانكلوزنج لو يعني تساله is
mirror.
it affect
Yes.
affect your driving لو مش افكت خلاص لان هي مش كل الستيجز
Yes,
تبقى
I heard also
No,
they
but
have
deformity you
solution.
have to stop. Deformity you have to stop because he will not be able to react in the car. Yeah, he has to stop
Yes.
once he has deformity.
I
And also
heard
for the
this
eye.
is only
psychosis
neck
والريستوبلمبر
neck
اللي
stiffness only.
Neck stiffness.
neck
But
stiffness.
I heard also they can arrange more mirrors for him he can drive with. I heard that
Just ask
specific
him
mirror.
if there is difficulty or not. I
Yeah,
think this is
I
the
agree for
only
this question. Yes, better,
Yeah.
yes.
بس لو فيها blurring vision خلاص هنوقف لحد until
Yes,
further
it is
assessment.
enough
Exactly.
cause. But I
Dr.
think
Basim,
she's
the issue
better
of
now.
driving,
Mm.
the issue of driving, not because of the vision problem and not because of the deformities. The issue of driving because of the neck stiffness and they are afraid of whiplash accident. So everyone with ankylosing spondylitis must stop driving. No issue of mirrors or any other options.
Thank you. Okay, thank you.
This is mentioned today by Dr. Ahmed Mahir.
Okay. To be safe, also mention that.
Yes,
No
for
need,
the
no
sake
need.
of the patient, yes, because
Yes,
of
yes,
whiplash accident, yes.
yes, you're right.
Because the neck is stiff and he cannot, as Dr. Sarah said, he
But
cannot
not
react.
all ankylosing have neck stiffness, doctor. That's said Polaroid of vision also, صح? Dr. Asana said Polaroid vision. If you have Polaroid vision, برضه difficult to drive.
This is other issue for
By default, ankylosing will have neck limitation. By default.
But
this
if
is for
it
the
is discovered
diagnosing,
early,
Dr.
if
Aisha.
Yes.
discovered early, no. If discovered early, completely normal. I saw two patients ankylosing for 7 years and no
ممكن
any
نقول
neck
له as
problem.
you have as you have decreased the neck movement and some blurring of vision, I better to stop driving until further assessment. خلاص.
Okay. Yes, exactly.
إن أنت
Even
عندك كده.
until we diagnose your case, because we don't yet diagnose him. So be safe. Yes, as you said, to be safe, advise him till we have diagnosis, not permanent, not DVLA. At least meanwhile, because you didn't diagnose him, right?
Even after diagnosis he will inform DVLA. They will evaluate. هما بيحسبوا الفيلد اوف فيجن والموفمنت اوف ذا نيك كم درجة بالظبط.
Okay.
sometimes they do adaptation ويزودوا mirrors وهي can drive. otherwise لو هو أبدا ما فيش no movement على النك خلاص he cannot drive.
I mean, in the meanwhile, Dr. Yusra, before you didn't diagnose him. Clinically, yes, you diagnosed, but still you don't have investigation or radiological diagnostic.
Yes, for his safety he should stop.
Yeah, better to say until we finish until we have diagnosis or problem explanation. Then you can arrange another meeting. This is my point. Okay. But
بس
you're
هي
right.
بغض once we hear vision yes stop driving.
Exactly. Yes, yes, exactly. If you mention temporary till we have diagnosis, it will be accepted by the examiner. I mean, if you didn't mention DIVLA here, he will not minus you. The safest answer is to stop driving, whatever. What?
By the way, Dr. Bassem, DVLA.
Sorry?
DVLA.
Yes, DVLA. You said DIVLA?
Yes.
Yeah, DVLA, yes.
That's why you have to avoid saying.
No. Yeah. You'll be used to say that. Okay, yes, you're right. DVLA. Okay, so the point is stop him driving to be safe for himself and others. That's it. Either to inform DVLA or not. It is not the time. You have to stop him driving. This is the most important thing. Okay. I think yeah, we have finished the discussion. Thank you, Dr. Sarah, for the case.
Thank you, Dr.
Yeah. Let's move to the communication. Dr. Shaima, Dr. Aisha, any question before moving? Okay, before that, please, the one who start as a candidate or as a surrogate can write the case.
Sorry, بس the gate is the Steve Stoop gate. This is the gate, okay? Because somebody asked for I search for it now. It's a Stoop Steve gate, as you said, Dr. Bassem, because of the back pressure.
أيوة يا شيماء هتعملي انت الكانديديت الأول؟
اكتب لك انا الاول. براحتك انا سعيد.
اوكي هديكي كانديديت الأول اوكي.
There is
اكتب
sign
لي
also. Yes, please. I want to add the sign of X-ray finding fusion of the spinous process, right?
Yes, that's right.
Yeah, this is another
The
sign.
most important thing is the sacroiliitis. I think this is the most important.
Yes, exactly. So bambusine, osteophyte, and fusion of the spinous process. I think also calcification of the body. I'm sure, but the same as bambusine, right? I think this is the
Yeah.
same.
The
Yes.
bamboo sign is because of the calcification of the
Exactly. Yes. Okay, you wrote the case, Dr. Thank you, Dr. Sarah, again for the scenario.
Thank you.
Okay, the question he comment, sorry, human leukocyte antigen not said hello. Okay. Any specific gates? The main issue. Every problem must stop driving, but patient has uveitis, you must stop the please. Okay, the case here, Dr. Shaima. She sent you the case for you. You are the doctor in the medical admission. You have been asked to see this man who has been feeling unwell and feverish since returning from holiday to assess patient problem and address the question and concern. He is marketing manager for engineering.
هي دي الحالة اللي أنا بعتها يا دكتور باسم؟
Yes,
لا
what
مش
is
دي
سوري.
دكتور باسم.
لا
لا
سوري
لا مش
معلش،
دي.
أنا بعتها على الجروب، هبشح دي وأكتب التاني. سوري، أنا بعتها على الجروب التاني. تمام.
Yeah, this is long, right?
مش عارفة إيه اللي اتبعت، بس أنا بعت التاني على الجروب.
Okay.
على الجروب واحد ثانية خالص.
Okay, I will send it here if you want. Or you want to do it? Sindusmophyte. Yes, Sindusmophyte. I remember this name.
خلاص أنا
Thank you.
بعت الجديدة. تمام.
Okay, thank you, Dr. Aish. If we have 4 long in the same day, means till the Fajr time.
والله إحنا ممكن نعمل دي، بس لو الدنيا اتأخرت
No,
بقى يعني.
it's okay. For 2 communication is shorter than the long. But 4 long is horrible, right? Really. But it's okay. You can do communication in the opposite side. I mean, communication with the long with communication. Okay, Mr. Clark has been seeing you in the clinic because of breathlessness. Chest X-ray has suggested pulmonary fibrosis with pleural thickening and plaques over both lungs. Lung function testing has confirmed reduced lung volume and impaired diffusion. CT scan of the thorax has confirmed interstitial lung disease with pleural thickening and plaques. All this is suggestive of asbestos lung disease. Mr. Clark, however, is unaware that he can claim industrial injury disablement benefit. Your task is to explain the finding of the lung function tests and the CT scan, explain the diagnosis asbestos lung disease, and to explain to him how to claim the industrial injury disablement benefit. Good luck, Dr. Shaima. When you're ready, just inform me.
انتوا قاعدين تجيبوا الحالات دي من يا كتب من أي كتاب؟
Good question.
أنا غالبا بجيب من رايدر غالبا يعني، أو تكون حالة عملتها مع إكزامينر بس.
لا، اللي بيكونوا مصورين تصوير كده يعني ما
من
مكتوبين
رايدر،
بخطير.
ده من رايدر.
اوكي.
Cases for Pace is also a nice book and simple one.
احنا
Rider
لسه
and
احنا لسه
Pace.
مستجدين حدنا الرخ. كويس. بعد نقرا
الرخصة
شوية
حلو
كده
مختصر.
بنستفكم من السورسز دي.
Sorry, the name of the book is إيه؟ What?
Rider.
No, the other one.
الرخ
Cases for basis and the row.
الرخ and basis cases for basis.
Mhm. Okay.
All scenarios repeated here and there.
So which is better to study for that? Because I have a problem with I think I have a problem with what you call it, another year. I can't remember the name in English.
No. The best way to read nowadays, pass medicine. If you have an account, don't read more informations.
Past test,
Pass medicine.
past medicine.
If you have account.
No, for history. For
No, she's
يعني
asking about information.
newly information.
أما
newly start عشان كده دايرة history
Inf-
abbreviation.
As a knowledge wise, pass medicine is the best for me.
past
But
medicine for basis they have for basis.
Sorry?
Past medicine, they have past medicine for paces or
No. I mean for topics. You are asking about topics, right?
I mean, I
Two
have
on one for what?
for the investigation, the management. Sometimes some
Yes,
points
pass
will not.
medicine, everything mentioned there.
Okay.
And simple, not complicated one.
Okay.
Part 2 or 1
Two.
for basic.
اوكي البوست تيست ده ايه الموقع يعني ولا ايه؟
Pass medicine. Pass
الموقع
medicine.
وصف
Yeah.
the
Q banks, but you will type the topic. What topic you want to read about? You can type search, and you will have the topic less than one or maximum 3 pages. Simple one.
ماشي يلا نبدأ.
Yes, ready. Yeah.
تمام.
Okay. Here you go.
Good evening, I am Dr. Zabel, the doctor in the London clinic today. Nice to meet you. Are you Mr. Claire?
Yes, I am doctor.
Are you Mr. Claire, 74 years old?
Yes, I am.
Mr. Claire, today we are here to discuss issue related to your rights. Is it okay?
Yes, doctor, please.
Is it okay with you?
Yes, doctor.
Mr. Claire,
My
can you
voice
please
not
tell me
clear?
how much you know about health status?
Well, doctor, I have some.
Mr. Claire, can you please tell me how much you know about your health status?
My voice not clear يا جماعة. My voice, there is any interruption?
Clear. There is some lag from her side, I think. Dr. Shaima, I think there is problem with your internet. Yes, I think because you are repeating the question.
طب ممكن تبدأ لها وقت تاني بقى معلش يا دكتور.
Okay, here you go.
Good morning, I'm Dr. Zabel, the doctor in the lung clinic today. Nice to meet you. Are you Mr. Claire, is 74 years old?
Yes, doctor, I am.
Mr. Claire, today we are here to discuss issue related to your health. Is it okay with you?
Yes, doctor, please.
Mr. Claire, can you please tell me how much you know about your health status?
I have 6 months, doctor, some problem in breathing, and I'm going frequently to my GP. Then finally he did he refer you to the chest clinic, and they did some tests for me and some scans. I am here today for discussing what coming up. What is the result of this test?
I appreciate your concern, Mr. Clerk, and I am sorry for your suffering. Can you please tell me what's your expectation?
I expect to know what is wrong with me, doctor, and to treat me.
Okay, Mr. Clerk. Mr. Clerk, actually, let me explain to you more about your condition. As you said, you came to us complaining of restlessness, and we did some investigation, and the result of these investigations have been revealed. And I am sorry to tell you that the result is not good as we hope.
What do you mean, doctor?
It reveals that you have a condition called asbestosis lung disease, or we call in medicine fibrosis, lung fibrosis. Have you been ever about this? Have you ever been ever about this?
No.
Do you want me to explain to you about
Yes,
this
please,
disease?
doctor. What is this disease? Yeah.
Actually, Mr. John, this investigation reveals that you have this disease, which is a medical term for medical condition in which there is scarring of your lung, extensive scarring of your lung, and also thickening of the lining of the layers that cover your lung. As I draw to you this lung, and this is the layers of your lung. There is a scarring inside your lung, and also there is thickening of the layers covering your lung, making your symptoms, which is short difficulty of breathing and this suffering. Can I ask you some question, Mr. Clerk?
Yes,
Do you
doctor.
what do you do for living?
I am plumber, doctor, for over 30 years.
For over 30 years.
40.
Actually, Mr. 40 years. Okay, actually, Mr. Clerk, this is disease may be due to your exposure to certain substance called asbestosis. Usually in job of plumbers and like the, and such jobs may cause to you this disease. This disease may
Are you
be
sure,
caused by
doctor? I
exposure.
am just unwell for the last few months, and I have been working there for 40 years.
Yes, this long period indicates that it affects your lung with long period of exposure. And this is disease actually due to the exposure of this substance.
So do you suspect, doctor, that all my
candidate.
problem due to my job?
Yes, I'm sorry to tell you that. What's the good thing, Mr. Clark, that you are a candidate for compensation? How do you know how to submit for compensation?
What is that, doctor? Can you give me some medication first? I'll be okay. How
Yes.
you will treat me?
We will actually refer you to a group of specialists, including chest doctor, including chest doctor, and we will give you some medications and social worker and also a specialized nurse, and we will give you some medication which you may decrease the progression. But as I told you, it is already progressed. And you have a severe, extensive scarring of your lung and also thickening in the lining layer of the lung. And
so
but we
I
will
am
give
not
you some treatment.
Be healthy again, doctor?
Actually, it is as the exposure for 40 years now, and this is extensive scarring. It may be irreversible. I'm sorry to tell you that. And actually, I'm sorry to tell you that it may complicate to cancer.
This is surprising, doctor. And why my employer didn't tell me that, and he didn't take any precautions that I not suffered like that?
I'm
If
sorry
it is known to you, known to anyone, I think, oh, this is just shocked me, doctor.
I'm sorry for this bad news for you today, Mr. Cliff.
So what I'll do now, doctor?
Regarding the medical action, we will refer you to, as I told you, to chest doctor and to specialized nurse, group of med specialists, and we will give you some medicine which will may decrease the progress of this disease. But as I told you, it is extensive now, Regarding the legal action, you are a candidate for compensation, and you can submit for this compensation.
How, doctor?
Can I tell you how you can, if you want?
Yes.
There is a special form for injuries, industrial injuries. You can submit. You can download it from the website or from the security office of your work, and fill it. And after that, you can submit it to what we call industrial injuries disablement benefits. They will assist you by a specialist doctor. You will assess you and take full history about your exposure to this substance. And if you are a candidate for compensation, you will give you compensation as regarding the degree of affection of your lung. Please do this as early as possible, because if you delay, you may lose your
So, doctor, are you sure they will give me money? You know, this will be conflict with my employer, and I should leave the work.
No,
are you
no,
sure?
it is not a thing against you. This is your right to take this compensation. And this office will assist you again, and they will not give you any compensation if you will not affected by your job. Actually, this disease occur mainly due to long exposure of this substance, which is called asbestosis.
2 minutes remaining.
Okay,
Mr.
doctor.
Mr. Claire, did you smoke?
No, doctor, I never smoke.
Okay, do you drink alcohol?
Yes, occasionally.
Okay, with whom you are living, Mr. Claire?
With my wife.
Is she supportive? Is she supportive?
Yes, doctor.
You want any type of support, Mr. Claire?
No, doctor. Just I don't know if I want to complain about my employer, if it is available or no.
You will submit for compensation. As I told you, there is a special form for that. You will download it, and we submit it for industrial injury disablement benefits. But you want also to complain against your employer?
Yes.
This is your right. This
Okay,
is your
doctor.
right.
I think about that. Thank you.
Okay, Okay. Mr. Clerk, if you want if you have any questions or any query, don't hesitate to contact me. I will give you my hospital contact number. Also, I will give you some brochures and some website about this disease to know more about this.
So I don't have
Mr.
cancer right now, doctor.
No, you didn't have cancer right now. But we will keep you under close follow-up, and we'll do our best. We are here to help you, Mr. Clerk. We will not leave you alone.
Thank you, doctor.
We will keep you under close follow-up, and we will treat you. We will doing our best to give you best treatment.
Okay, time is up. Yeah.
Okay, well done, دكتور شيماء.
أظن الإمباثي والسيمباثي المرة دي أحسن من المرة اللي فاتت.
لا ممتاز ما شاء الله. حلو.
But your voice, Dr. Shema, when you are a candidate, your sound is clear. When you are surrogate, your sound is muffled. I don't know. You got it?
لما أكون surrogate هو اللي ببقى muffled.
We can hear you well while you are a candidate.
Okay.
Clear, I mean,
okay,
clear.
I will raise my
Yes, please.
Okay.
Okay. The sympathy and empathy, yes, much better. Yes, you can comment, Dr. Aish. Sorry for interruption.
No problem. Okay. The introduction is good. You will start by explaining the result of test, like you said, or we can say the scarring of lung tissue with thickening of lining around the lung. Okay. Also, we can set the hardened patch, calcified leaks.
Okay.
اسمها ايه بقى؟ hardened batch. hardened batch.
Calcified patch.
اه.
Okay, this is
Calcified
the
batch.
plex. Yes, the
مم.
plex. If you will explain also the plex, because there is thickness and multiple plex.
ايوه
Okay,
شفتها دي بقى شوية.
and according to diameter of this plex, they discuss about the compensation. So you should mention, or you can mention it. It's hardening batch. Okay.
مم. مم.
Okay, this is, you will say all this for asbestosis exposure. Ask us about the occupation, but you will ask what you did in this, and what you did exactly in your job, throughout your job. So you will see some also like details. They said like that. He can say, I am like by blagging, in insulting materials, field, that there is some sites in the factory that is not has much exposure. So just ask. You cannot understand what he will say, but just you will take idea, or the examiner will take idea that you explaining or trying to take details.
وانا
Okay.
ممكن اساله كمان على البريكوشن، هل اخذ بريكوشنز ولا لا؟ هل كان بيلبس ماسك during
This is from employer. He said this employer rule. He should always making like rounds and ensure that. Okay. Explain, unfortunately, treatment is limited and asbestosis don't tend to progress slowly. You give him some hopes and no hopes here, no treatment, no anything. What treatment do you mean by for this patient?
steroid.
No steroid. What steroid here? There's benefit for steroid for asbestosis
مش عارفة أقول. يعني
or
مفيش treatment.
pleural thickness.
يعني
I
مش
think no
المفروض
rule here. It is not idiopathic.
الفيبروز.
Pulmonary fibrosis is not related to immune condition. It is just scarring and happened.
انا لما يكون مثلا عندي ميزوتريكسيت مثلا induced fibrosis، فوقف الميزوتريكسيت وادي
Yes,
steroid.
some type of fibrosis, but this is asbestosis. This is asbestosis enter the lung and making like fibrosis around. What you will do? No any medication for asbestosis and for pleural thickness. For
مش
this
هتابعه حتى، مش هتابعه تاني. يعني خلاص هسيبه كده وخلاص.
No, just you will said like that. Unfortunately, treatment is limited for symptoms, and asbestosis tend to progress slowly. Okay, just say this. If he ask cancer, you reassure no evidence of lung cancer, but
But it
we
may,
can.
but it may progress.
Rehabilitation
Yes,
only.
like that. It is can occur. There is lung cancer can occur, and we will follow up regarding that. Okay, yes, this answer is very good. Okay.
Yes, it might happen.
Yes.
I remember smoking times asbestos make the cancer 50 times the possibility when the asbestos alone or the smoking alone. But asbestosis, smoking,
and ايه؟
and that's asbestosis.
If combined, I
Yeah,
don't
I
know.
think
I can't remember the percent exactly, but it is increased risk. Yes.
5 times 10. I think 5 smoking, 10 asbestos together will be 50%. Okay, go
Okay.
ahead. Yes.
Okay. The other, as you said, you can make him aware that he able to claim the industrial for the industrial injuries disablement benefit. We should keep this long sentence in our mind because they may not mention in scenarios. You should know this.
industrial injury
الهيئة دي أو المكان ده we should know. Yes. Industrial injuries disablement benefit. Okay, he will obtain a copy, as you said, from secretary, from his work, from online. Okay, and he will fill it. Then he will apply it again for the same industrial injuries. Okay. Okay, what other diseases for the same situation will be pneumoconiosis and mesothelioma. There is also there is primary lung cancer related to asbestosis. Okay, if they confirm also. Okay.
يعني نيموكونيوزيس دي برضو industrial قصدك ولا ايه؟
Yes, سكول بتاع الفحم دي. I'll mention this in the last. Okay.
You mean cold pneumoconiosis, right?
Pneumoconiosis, yeah.
Pneumoconiosis, yes.
Okay. Okay, after that, they will investigate, as you said, they will contact with your employer and they will contact with doctors, and we will disclose the information of you. This important point that you will set. We'll give them the examination and the investigation. And as you said, this must be in the, as early, because it is about 3 months. If you are late, they may be not candidate for compensation. Okay. If it's, you will compensate it according to their decision. They have a specific team that will decide about how many or how much he will take. If he asks, are you sure? No any promises. So I'm not sure. This is they investigate and they will provide you with the result of this investigation. Okay. There is the diseases that is for compensation. I'll mention it. Okay, about mesothelioma, you can mention if the cases if mesothelioma there is option of operation. Okay, but here no option of treatment. For complaint, he can complain the employer, no problem, and it is away from compensation. He will not take the compensation from the employer, by the way, so he can also complain. So if he mentioned that, you said yes, it is your right. Okay. I'm trying to take the names of the diseases.
Dr. Aisha, I remember what's called a legal advisor. These are the concerned office, I think. Or this is the intermediate.
I don't know. You may for complain, yani?
Yeah, for the compensation. Who
Yes. No,
لا هو
this compensation is specific
البنفيت ده للاوفيس ده
specific
اللي هو
agency.
الانجري اسمه ايه؟ اللي هو industrial injuries disablement benefit office، هو اوفيس مخصوص للحاجات.
Yeah, first time to hear about. Okay. Are you
Okay,
done, Dr.
I'll
Aisha?
mention the disease on the group when I found, because it's like a lot of words and I missed to mark it.
It's okay. Dr. Shaima, please can you write the scenario for Dr. Aisha?
Yes, it is silicosis and cool worker pneumoconiosis.
Yes.
Okay, silicosis and cool worker pneumoconiosis and something called.
الله يخليك يا عايشة، معلش.
You mean the
حتى
occupational?
الاوكيوبيشن الأزمة حتى
We are
Yeah.
now asbestosis, okay? There is
Yes.
silicosis and the cool worker pneumoconiosis. It's not coming before, but the asbestosis usually the one come. But يعني we
This
will know
exposure
if
from
they trying to change the scenario.
I think the mine exposure in the mine for silicosis or core worker pneumoconiosis.
No, cool worker pneumoconiosis. This is
For the mine. Yeah.
cool فحم وكده.
Okay.
Something called the BCNOs. I'll mention it in the group because I can't read it. But this is all the diseases that is other and sterile disease that claim. Okay.
Okay. What's the difference between silicosis and coal worker pneumoconiosis and asbestosis?
Asbestosis, this is industrial different.
No, if I mean
Ah.
in the disease.
the disease يعني
Okay,
picture.
yes.
Upper
Yes.
and lower lobe fibrosis. Asbestos
Yes.
lower.
Yes,
The
exactly.
other are upper, yes.
Yeah, all occupational are upper except asbestosis. Asbestosis only the only occupational basal
Mm.
and the
I
connective
think
tissue
Dr.
disease.
Basim, the legal advisor,
Yes.
they are the one who assess the patient with the occupational health department. They assess the patient and they assess the affection of the patient by the exposure to this substance, and they will together يعني with the occupational health department
Mhm.
assess how much he need يعني for compensation. I think this is the legal advisor.
Okay. So he is the intermediate
Yes.
person.
Yes.
Yeah. Okay. To
Or
guide.
office, I think office,
Yeah.
they
He
will
will
help
guide.
regarding
Yeah.
yes.
Okay. Thank you.
You're welcome.
قلت لك connective tissue all connective tissue disease lower except ankylosing upper صح مش قلت كده؟
Yes, exactly. Yes. All are lower except ankylosing. Occupational all are upper except
except asbestos.
asbestosis. Yes, exactly. Yes.
How to define the asbestos plaque, Dr. Aisha? You said hardening of
hardened pitch. hardened pitch.
What is the
hardening
scenario,
patch.
Dr. Shaiman?
على الجروب.
Okay.
Okay. Hardened lips, yes.
hardened pitch.
If you couldn't describe, you can say lesion.
عديها وخلاص هي
Even,
التكنيك
even, even the hard, I can't even pronounce it. How I can remember it? Anything you can mention to the surrogate in simple way, it will be accepted. If you don't know, for me, I can say lesion or something abnormal. Sometimes the explanation itself is difficult. والله. Like hardened batch, you mean hardened or calcification?
لا الكلاسيفيكيشن دي ما اعتقدش ان هي تفهمها كبيشن
Jargon,
يعني
right? Jargon. I think calcification jargon. Yes. Okay.
hardened
So
pitch.
yes. Okay. Dr. Aisha, your scenario, you are the senior house officer in the medical OPD. Mr. Smith complaining of recurrent abdominal pain, bloating, loose motion, altered with constipation. All investigation are normal, diagnosed as irritable bowel syndrome, not responded to regular medication. Your role, sit with here, Mr.
him
Yes, him, yes, sit with him, explain diagnosis and need to add amitriptyline. 2 minutes, then we'll start.
How old the Mr. Smith?
35.
Okay, let's start.
Okay, here you go.
Okay, hello, I am Dr. Mutwalli, the doctor in clinic today. I confirm you are Mr. Smith, 35 years.
Yes, doctor, I am.
Okay, we are here today, Mr. Smith, to discuss about your health condition. Is this okay with you?
No, I am waiting for consultant. I need your consultant.
I appreciate your concern, Mr. Smith. Can I know why you are waiting to meet the consultant?
I want to meet your consultant because no one take my symptoms seriously. No one take my symptoms serious.
I
I
appreciate
want
how
to meet your consultant, please.
I appreciate how
where
this is
where-
bothering you. Yeah. I raise your concern to my consultant. Make sure that I'll do that. If you can discuss your condition with me, I'll tell you about what's going on right now till we arrange another meeting with consultant. Is this okay?
Why isn't you attend this meeting?
He already mentioned me to speak to you, and I raise your issue about talking to you specifically, and make sure he will appreciate that and he will respect that, and we will arrange in near future another meeting.
Okay.
Okay, Mr. Smith, can we discuss about your health condition right now?
Yes.
Okay. So what's your expectation from our meeting?
I don't know, doctor. I have this pain, tummy pain, and this constipation sometimes, and sometimes hard motion, sometimes loose motion. I think I am afraid, doctor. I'm afraid that may have a cancer.
I appreciate your words too much.
No one take my symptoms serious, doctor. No one.
So how much you know about your condition till now?
Every doctor say to me, I didn't have anything, but I feel symptoms. I am suffering, doctor. I'm suffering. Believe me, I am suffering.
I
I'm not
appreciate that very much, Mr. Smith, and I know how these symptoms may bothering the life of anyone. I'll explain to you to what point we are now stopping, if you let me.
Okay, doctor.
Okay. Mr. Smith, after we take some test for you, we make confirmation that you have condition called irritable bowel disease. Have you ever mentioned this term before in front of you?
No, doctor, no.
Okay, so this is irritable bowel syndrome. It is a condition that there is like a problem in functioning your nerves and cables. There is send and receiving signal that is maybe not appropriate to in your body, and this make different symptoms and different problem to you. And in your case, this problem is with your gut and with your tummy specifically. Are this is clear, Mr. Smith?
What do you mean, doctor? What do you mean?
I mean that your disease not a really like structure or something wrong. Specifically, we found in our test, we found all your test result as normal.
From where my
Your voice not clear.
From where my symptom, doctor? From where? I am really suffering. From where my symptoms is there is equal, everything is good.
I appreciate really your concern, and your suffering is too much. I know, Mr. Smith, and you're really suffering, and we are thinking about that. you have some problem in your body we called a functional disease. Don't bother about this name. It is like a false signal coming and receiving to your brain and causing to you much pain. There is also some action from brain, like the symptoms. You have some colic sometime and some pain that you have. And this is known in our medical practice, and it is known condition, and we have some medicine for it. Are you follow me?
Okay. Yes, I'm following.
Our consultant, after discussing your case, he decide for you some medicine for your condition. It can help you so much.
Okay.
This medicine called amitriptyline. Are you know this medicine before or take it before?
I think this is a medicine for mad people.
The
Am I
voice
mad?
is too far, I think.
Am I mad, doctor? Is this medicine for mad people? Yes, I read about it.
I
This
appreciate
medicine
your
for mad
knowledge, really, Mr. Smith. Yeah, this medicine can we give for different condition. In medicine, we can give medication for different condition, and it can work by different ways. In your condition, we will give this medicine by different amount that we give in another medicine, like mood problem or any problem with bad mood in some other cases, or some cases of shaky movement. In your case, you will take some other doses for it, like small amount from this medication, and we will follow you. Don't be afraid. This is a best for you, and it came with good result with others that trying it, and there is you will relieved from you can relieve from your symptoms if you take it. Is this okay, Mr. Smith?
Okay, doctor, I will think about it.
Okay, just I'll give you some advice, Mr. Smith, about this medicine. You should take it at night at first, because it may cause some drowsiness to you. And I advise you also about another thing is in your life. But let me ask you, what do you do for living?
I am businessman.
And how stress your work?
No, I am sorry for out in business. Okay. Stress, it is stressful, doctor. It is very stressful. Everyone has stress in your life, in his life. Everyone, no one living without stress.
Okay, I really advise you, Mr. Smith, to making your work more comfortable by like bringing other secretaries or someone to arrange your work, and any work you can handle to anyone to finish. This can really reduce the stress for you, and I advise also to take like breaks through the years, and it will also help in your symptoms too much. Okay.
What, doctor?
Break.
Breaks.
Job, yes, breaks. And with whom you live, Mr. Smith?
With my wife.
Do you need any support at home, or you have any struggles at home?
I'm doing well. I'm doing well in my life.
Okay, this is
I'm
good.
doing well in my life too.
1 minute left.
I advise also you about your diet, Mr. Smith. You should moderate your caffeine intake. You should also avoid like spicy foods and junk foods.
I'm afraid I have a cancer. I said to you, I am
I
afraid
appreciate
I have a cancer.
yes, your concern too much. It is not a cancer right now, but if you have any like a problem in changing in your symptoms, any blood in your back passage, any loss of weight, you should seek consultation. But right now,
Yes.
we are sure about it's not a cancer right now.
Okay.
We need from you also, Mr. Smith, to reduce stress as much as you can, and to sleep good, and to follow up with us after starting this meeting if you decide that. So we can manage you good and we can handle your case. We have a lot of medication. They can contribute to relieve your symptoms if it bothering you. It's okay.
Okay.
Thank you.
Thank you.
Okay, time is up. Yes. Well done, Dr. Aisha. Please, Dr. Shema, can you comment first?
ما شاء الله عليها، يعني عملت كويس جدا. انا بصراحه خضتها في الاول، معلش. لما قلت لك لا انا عايزه كونسلتنت، هو فعلا على فكره الدكتور محمد عباس الله يمسيه بالخير قال لنا مره ان ده حصل فعلا، يعني قال له كده why you came
ربنا
here I am
يستر.
with your consult. فالمفروض ان الواحد يعني يبقى عنده ثبات انفعالي كده، وزي ما انت عملتي تقولي my consultant is little bit busy now and he informed me about the case and about the condition, and if you want if you have any concern I can answer your concerns. انت عملتيها كويس جدا يا عائشة، بس كان بس في شوية كمان سايد افكت تانية للاميتريبتالين، اللي هي دراي ماوس وفيلينج سليبي وفيلينج تايرد.
هو بيعمل حاجة تقريبا في الغدة أو في القلب، مش فاكرة حاجة كده ولا إيه؟
مش فاكرة
لونج كيتي،
مش
لونج
لونج
كيتي.
كيوتي.
Yes.
بس ما أعتقدش هنقولها يعني.
لا مش هنعمل. هو اللي اتقال المكتوب يعني اللي بيتقال دايما هو دراي ماوس وفيلينج سليبي وفيلينج تايرد،
دراي ماوس.
عشان كده
أيوة
بتاخديه بالليل وما تفوقيش بعدين.
Anticholinergic or sorry, cholinergic effect.
يعني احنا بنقول له ما تسوقيش بعديها، ما تاخديه ما تسوقيش.
ما أنا قلت لها خدوه ات نايت عشان هو بيعمل سليب. تمام. أو دراوزي يعني.
وبعدين تريجرنج فاكتورز زي ما انت قلتي، بس قلتيها في الاخر. يعني هي المفروض ان like food
ما
or
اديتنيش
some
فرصة
kind of
شيء
sensation.
انت من اول
معلش هو يعني ممكن يحصل كده، يعني ربنا يعافينا يا رب ويبقى الموضوع سموث، بس ممكن يحصل لنا كده يعني.
يا
معلش.
رب ان شاء الله.
بس هو في شوية حاجات بس هقولها بسرعة كده، اللي هي
لا
ايه
كويس ان
فاكتور
انت قلتي لي. هو الرد بتاعك احسن من الرد بتاعي كتير، يعني ان هو بيزي وهي told me more about your condition and I'll answer all your concern. بس ممكن نقول
بس
زي ما قلت برضو
رديتي
I'll arrange
حلو
a
جدا.
meeting.
But the way you mention also, Dr. Aisha accepted.
جميلة جدا ما شاء الله.
Yes,
انت
I am
قلتيها
here.
حلو.
You can say I am here on behalf of him. I am here. He sent me to you. I am assigned by him to meet you. I guess, Dr. Shaima, if you said he's busy, he will tell you why I'm not important to be meet by him. I think also not to say he's busy. Why he's busy and he's not meeting me. So the best thing, yeah, he sent me to you, and he will be with you in another meeting. I guess so. I don't know if accepted to say he's busy, he will accept that. You got it?
على حسب بقى درجة الرخامة اللي هو هيبقى عايش فيها، يعني هو مستعد.
This meaning an other patient important than
Yes, I guess he will be irritated more. Why he's busy away from me? You get? Because I want to meet him. Let him meet me. Why he's busy? He should be busy with me, not away from me. Because we are here
بس
offering
انا ممكن
our
افويد الكلمة
service.
دي وخلاص عشان ما يعلقش فيه.
Yeah, I think the busy is little
يعني
irritating.
هو inform me to about condition and take
Yeah,
care
he
of
informed me about your condition and he will be back soon with you to sit with you in another meeting. I'm here now to address your concern and be sure that I'm here on behalf of him. I will try to help you as much as I can.
اوكي. هنرجع بس لبقية الحاجات دي يا عائشة، اللي هي بس التريجرز. لما انت بتقولي ان التريجر دي بتبعت للبرين، والبرين بيبعت يعمل ايه امبulses يخلي الباولز تمشي تبقى اوفر اكتيف يعني. التريجرز الستريس والانفكشنز وسيرتن تايب اوف فود. اوكي. عشان كده انت ممكن كمان تعمليها ريفير للدايتيشن، عشان وتافويد السبايسي فود والكافيين والكافيين نوتي درينكس. اوكي.
تمام.
تاني حاجة
ولا
لما يقول لك لو عندك وقت بقى، يعني لو عندك وقت أنا عارفة مفيش وقت، بس لو في وقت، لو قال لك مثلا في أول كونسيرن ليه do I have a cancer دكتور، هتقولي له why you think that you have cancer, if you have any family history of cancer, if you have any زي ما انت قلتي كده there is alarm signs for cancer that include loss of weight, recurrent progressive symptoms, recent progressive symptoms, melena, black stools, or vomit or throwing up of blood, swallowing disorder, difficulty swallowing. All this not present now. This is alarming sign. If you have any of these, we can reassess you. But right now you didn't have cancer. زي ما انت قلتي بالظبط. بس هو بس بفكرك بالالارم ساين. الالارم كلمة alarm. أول حاجة A anemia. L loss of weight. R recent progressive symptoms. M melena. طبعا احنا مش هنقول melena هنقول black stool أو hematemesis. S swallowing disorder. alarms. alarms هي دي يعني لو عندك أي symptoms من دول تعالي نعمل لك reassess تاني. بس I want to act بس خلاص كده. لا المفروض كان في concern تاني إن هي لو أنا محتاجة I want to do CT again أو camera test again. هتقولي بقى إن every investigation has risks and benefits and there is no need to expose you to this risk without alarming sign. If you develop any symptoms of this alarm sign, we can reassess you and do this investigation again. Okay.
only social history allowed.
يا حبيبتي.
بس كان في حد بيسأل ممكن ناخد history فقلت بقول only social history but no diet.
لا مش no
just
diet.
give it as
Yes,
advice. Give
إحنا مش
all
مش
the
هناخد
things as advice.
regarding
إحنا بس
yes,
But the social allowed a job and living with and smoking. I
there
forgot
is
the
alarming
smoking.
signs which is not
I
present
forgot
now.
smoking.
yeah, as an instruction only, as an instruction. Yes, red
أيوه.
flag.
هنقول yes. هنقول there is alarming sign which is not present now. This alarming sign include low blood count and loss of weight and recent progressive symptoms, black stools. This is not present now, and so you don't have any alarming sign. If you have
Yes.
any of this, after that, if you develop any of this, you can come and we reassess you again. But until now, you didn't have cancer. I reassure you. I reassure you.
Okay.
Yes, but regarding the point, if you have family history, it's not allowed to ask also. You said family history.
والله يا دكتور محمد عباس قايلها مش عارفه. ماشي خلاص ما نسألهاش.
You can ask a family history. No. You can.
دكتور محمد قال له كده why you think about cancer? Is anyone of your family has cancer? I need to do further investigation. No need
Not-
for كده بقى.
Yeah, not as a question. Is anyone in your family has cancer? No. You can say we can do that if one of your family has cancer in his colon.
I think
بص
to be neutral, just ask why you are asking أو thinking about cancer. بس ونسكت. هو
there is no alarming signs.
حد يقول في الفاميلي يقول من برنت وغالبا بيقول فريند على فكرة. مش عندي فريند أصلي ومش عارفة ايه. طيب هو السيناريو ده بجد مهم قوي وانا كنت بخاف منه جدا اعمله اول مره اعمله. فكويس انتي قلتيهولي. انا ما كنتش بحب اعمله ابدا.
انا برضه
بحس ان هو رخم جدا وفي كونفليكت كتير ويقعد يقول لك انا مجنون. طب انت مش مصدق ان انا تعبان وكلام زي كده. دي الحمد لله ما قلتليش قوي الحاجات دي كتير يعني. بس هو في السيناريو الحقيقي بيقولوها كتير قوي.
ما انا قلت لك كنتي قلتيها كويس الحمد لله.
لا بيعيدوها ويزيدوها بشكل يعني انا مبقاش عندي اي كلام غير ان انا اقول this is you suffering, this is false signal. بس هو في السيناريو الحقيقي بحس ان الموضوع رخم.
دكتورة هند مرة قالت في كلام كويس قوي بس حسيتها طويلة قوي. قعدت تقول ان هو ممكن يكون حاسس بنجاح شديد بس هو overwhelming اصلا. overwhelming وستريس لآخره. هو متخيل ان هو كويس جدا ومفيش عنده مشاكل. من كتر ما هو overwhelming مش حاسس بان هو عنده مشاكل اصلا.
But the solution Dr. Aisha offered very important. Sleep well and take breaks from your work. Try to go vacation with your friends, with your family, with lovely person. All this can improve his stressful condition in his life. You can give
this is
it
a very important point in this
Yes.
scenario. You should mention.
even without asking, Dr. Shema, you can
Just
enumerate
use
it.
trust.
Yeah, as
Sleep well, try to
instruction.
take vacation.
Exactly, yes, without asking it, because you might ask and you will wait for the answer, and she will take more time to give you answer. And yes, I have, doc. So if you have less and short time, and the scenario or the time almost will be finished, you can give instruction one after one. Please be away from the spicy food. Don't drink, as Dr. Aisha did. Don't drink a lot of coffee. If you are smoking, please stop smoking. The alcohol as well, it worse the condition. But if you have time, these questions are okay. Social, stress, alcohol, less sleep, and also financial. If you have time, if you don't, try to collect them in one advice. Please avoid 1, 2, 3, 4, 5, 6 till the end of the meeting, or till the 2 minutes remaining. What's your concern? You have any other concern? No, doctor, thank you. You can again give him the red flag at the end, please. Whenever you feel the tummy pain worse than usual, or back passage coming with blood, or the loss of weight significantly, the appetite is not okay, please don't hesitate to call us or to come to visit us.
Yeah.
Yes, like this. I think Dr. Aisha, you did it great. And always the thing yeah, Dr. Shaiba also did great today. Always the scenario you're afraid of, you will do the best performance in. In Arabic يعني اللي تخاف منه ما يجيش أحسن منه يعني إن شاء الله يكون. Yes. إن شاء الله. Okay, any question?
Thank you. Thank you.
بكرة حضرتك دكتور باسم هتعمل communication. ممكن أنا
Yes.
وعائشة نعمل
Yes, yeah, إن شاء الله.
تمام إن شاء الله.
Okay. Okay, see you tomorrow إن شاء الله. Any question before ending? Okay, see you tomorrow إن شاء الله. Good luck and good night. السلام عليكم ورحمة الله وبركاته.
عليكم السلام.